Hello, you're welcome to Skyline Tutorials. For this episode in anatomical series or in anatomy series, we'll be discussing directional terms. So our focal point for this episode would strictly be in directional terms. It is very cardinal that you take note of all of these directional terms as it will be used interchangeably in different cases when we dive deeply into anatomy. We'd use all of this in describing direction, just like the name implies, directional terms, okay? So in anatomy, we have some terms that are specifically for certain directions. So pay attention closely to the different directional terms in anatomy and what they entails, the different positioning and all of that. Okay, for the first directional term, or first of all, let's list as many directional terms that we are going to achieve for this episode. We have medial. Okay, so here we have different directional terms that are used in anatomy. We have the medial, we have the lateral, the ipsilateral, the contralateral, the anterior, the posterior, the superior, the inferior, the internal and external, the superficial, the deep, the proximal, the distal, the supine, the prone, and palmar and dorsal. They go hand in hand. Okay, so let's quickly look at them individually. Let's look at the medial position. The medial position. The medial is used for describing positions that are nearer to the mid or the middle or the median plane of the human body. The medial describes positions of structures that are close to the median plane or the middle of the human body. Remember, we said that the median plane in the previous episode is a plane that divides the body into two equal left and right. So would have the median plane somewhere around here. So any structure that is closer to the median plane is termed medial. For example, the eye and the ear. You'll notice that the eye is closer to the median plane than the ear. So the eye will be referred to as the medial. So the medial position is used for describing structures that are closer to the median plane or to the mid of the body. The next we have is lateral. Lateral is the direct opposite of median position. Lateral simply indicates structures that are further apart from the median plane, or we can say that a lateral describes structures, organs that are at the sides of the body. Take note of that. So for that analogy we give, you would see closely or clearly that the ear is lateral while the eye is medial. Take note that all of these directional terms are relative. We'll get to understand what relative means as we proceed. Lateral simply means by the side. Ipsi means the same. So when we say ipsilateral, it simply means structures that are in same side. For example, the left upper limb and the left lower limb. They are ipsilateral. They are in the same side. Okay? So ipsilateral simply means structures that are in the same side. Contralateral, contra to contradict. It is the opposite. Okay, so the upper left limb and the upper right limb are contralateral. They are in opposite direction in in terms of side. Remember, lateral simply means by the side. So for contralateral, it depicts structures that are in opposite sides. Take note of that. We have anterior or ventral. Anterior can also be called ventral. This indicates positions that are in front. Okay? It indicates positions that are in front. Take note of that. The next we have is posterior. Posterior or dorsal. This indicates positions that are towards the back. As this is towards the front, this is towards the back. They are directly opposite directional terms. Take note. Posterior can also be called dorsal. So anywhere you see this, they can be used interchangeably. The next we have is superior. Superior can also be called cephalic. Cephalic. Superior or cephalic describes structures that are towards the head region, that are in the upper part of the body system. So superior or cephalic simply means organs that or structures that are in the upper part of the body. For example, the nose is superior to the mouth. Is that okay? I said something earlier that all of these positionings are relative. Note, the ear is superior to the nose, right? Yes, the ear is finds itself towards the head more than the nose. So in relationship or the relationship between the ear and the nose, the the ear would be superior to the nose. On the other hand, the nose would be superior to the mouth. If I am looking at these three structures, the ear, nose, and mouth, we are trying to explain how all of these are relative. The ear is more in the upper region than the nose. So we can say that the ear is superior to the nose. On the other hand, the nose is superior to the mouth, while the mouth is inferior to the nose. So have you seen how that it is relative? This can be seen as inferior depending on the organ we are looking at in relation to one another. So take note of that. Inferior can also be called caudal. This describes this describes structures that are towards the feet. It describes structures that are closer to the feet. So anytime I have a structure that is below another, I say that the structure is inferior to that. So in this case, our mouth is inferior to the nose. Internal and external. Internal and external simply indicates positionings of structures that are within an organ or outside an organ or within a cavity or outside a cavity. Okay, so we have internal and external structures. So using the overall body, we can easily cite external structures. External structures like the ears, and then internal structures like the liver. So we use this to depict positions that are within or out of the body organs or cavities. The next we have is superficial. Superficial position simply means a structure that is towards the surface of the body. Towards the surface. So, superficial towards the surface. Let's use the blood vessels to illustrate this. We have generally three blood vessels: arteries, veins, capillaries. But let's use arteries and veins to exemplify these two. They go hand in hand also. Superficial refers to structures that are towards the surface. Deep refers to structures that are away from the surface. They are more interior. Take note of that. Note that in the skin, we easily find veins. We easily find veins in the skin. The reason is, if peradventure it were to be arteries, you realize that anytime you have an injury, the amount of blood that you will lose will be more, because it is the arteries that actually does the pumping or that does the releasing of oxygenated blood, right? So it comes out with more force. So imagine you have an injury in the artery, you would lose a whole volume of blood. So that is why the arteries is now tilted away from the surface so that it can be barely injured. So that is used for, or those are the terms that we use for describing structures that are away and in the skin. Okay, we have proximal. Proximal simply means structures that are close to the origin. Distal simply means structures that are away from the origin. We have what we call proximal convoluted tube, distal convoluted tube in the urinary system. Realize that the proximal convoluted tube is a tube that is found closer to the origin, while the distal convoluted tube is one that is found farther. So for distal, it is used for describing structures that are positioned farther from the origin. Proximal is used to describe positions that are closer to the origin. Take note, supine, supine. Supine is also a position that indicates an individual or the body lying down and the face facing upwards. You're lying down and the face facing upwards. We describe that kind of position as supine. The next we have here is prone. For prone, you're lying and your face is towards the feet. In supine, you lie down and you face downwards. In prone, you lie down and you face downwards. In supine, you lie and face upwards. Take note of that. For palmar and dorsal, they are basically or strictly used for the hands. So this is the palmar. The palmar is the anterior part of the hand, while the dorsal is the posterior part of the hand. So basically, this is it for the directional terms that are used in anatomy. Do well to take note of all of these directional terms and what it means. We are going to encounter a lot of them, especially in the description of different organs in the systems, because in the description of a system, many a times you will be asked to indicate their positioning in relation to one another. So it is very cardinal and pivotal that as an anatomy student, you get to be in the know of the different directional terms that helps in describing positionings in different body parts. Ladies and gentlemen, we have come to the end of this episode.